This video will introduce you to childhood immunisations to improve your knowledge and understanding of immunisations and their importance, the childhood immunisation schedule, the barriers and myths surrounding immunisations, and the role you can play in supporting vaccination uptake in childhood. What are immunisations? Immunisation is the term used to describe the process of having a vaccination to build up an immunity to a disease or infection.
An illustration of a pair of scales is shown. On the left-hand side of the scale is a gold-coloured circle with a pound symbol. On the right-hand side is a syringe and needle with a bottle of vaccine. The scales move quickly up and down on each side before settling evenly balanced. The frame then zooms in on the illustration of the syringe, needle and bottle, which morph into two podiums marked first and second. The first podium has a water drop over it, and the second the syringe, needle and bottle.
The process of immunisation is one of the most cost-effective public health interventions, second only to clean water in preventing childhood mortality, helping to prevent the spread of disease, promote child health, and create opportunities for children to get the best start in life.
A line is drawn on screen from left to right. The line then curves around to run right to left, then curves again to run left to right. As the line progresses, dates ranging from 1796 to 2020 appear along with an illustration of a virus.
Immunisations protect against a wide range of diseases, with vaccinations evolving significantly since the development of the first smallpox vaccination in 1796.
A series of 7 blue-coloured stick people representing different life stages are shown. The stick people representing a child and an adolescent pulse and turn green.
Immunisation begins shortly after birth and continues throughout the life course. Many important vaccinations that offer our lifetime protection are given during the childhood and adolescent years, where we receive immunisation for 18 infectious diseases. These include diphtheria, pertussis, also known as whooping cough, polio, measles, meningitis, rotavirus, and tetanus. How immunisation works.
4 rows of blue-coloured stick people fill the screen. The majority of the stick people turn green. Then one pair of people in the middle of the screen turn pink. After a few seconds, the pink stick people turn blue again, followed by the majority of the remaining stick people turning blue, leaving a few green. The middle pair of stick people then again turn pink, quickly followed by the surrounding ones, rapidly spreading outwards until only a few green ones remain.
When enough people in a population are vaccinated against a disease, it becomes very difficult for that disease to spread, as there are less people it can infect. This means that the disease will soon disappear. However, when vaccination rates are low, there is much more potential for a disease to spread quickly within the population, as there are more people for the disease to pass on to.
Illustrations of 3 different viruses are shown. Each virus has a pair of stick people in front of it with the text 81% below the first, 95% below the second, and 80% below the third. The first and third set of viruses then fade away to focus on the middle one.
The number of people who need to be immune to a disease to prevent it from spreading differs with each disease. For measles, we know that at least 95% of a population needs to be vaccinated to prevent it from spreading. The remaining 5% will be protected by the fact that measles will not spread among those who are vaccinated. This is a term known as herd immunity. How and when vaccinations are given.
The NHS vaccinations and when to have them web page is shown. This is followed by an image of a red book with a drawing of a teddy bear on it.
The childhood immunisation schedule can be accessed on the NHS website. This provides information on the age that vaccination should be given and the types of vaccines that will be offered at each visit. This information is also available in the Red Book, My Personal Child Health Record, provided to new parents shortly after a child is born. To access the immunisation schedule, visit www.nhs.uk /vaccinations/NHS-vaccinations-and-when-have-them/When children are due an immunisation, the doctor from their registered surgery will make parents or carers aware. How this is communicated can vary from practice to practice across Leeds, and it could be in the form of a letter, text, phone call, or email. It is therefore important that children are registered with a GP practice when they are born. The Year 8 and Year 9 vaccinations are given in school when consent has been provided. Vaccines are not mandatory and cannot be given without consent. Whilst it is best for children to have their vaccinations according to the NHS schedule to offer optimum protection, it is never too late to catch up on missed vaccinations. You can call your GP to book in or check whether you have missed a vaccination.
Immunisation coverage.
A graph depicting a gradual declining trend in the number of children receiving vaccinations over the last 10 years is shown. This is followed by an illustrated map of the UK. Within the map, several illustrations of viruses appear.
Over the past 10 years, there has been a gradual decline in the number of children receiving their vaccinations, which has contributed to the re-emergence of some diseases that had previously been eliminated in the UK.
The map and viruses are still on screen. After a few seconds, the viruses shrink and fade. The map is then replaced by two stick figures with an illustration of a syringe and bottle above them and the text 95% below. The two figures are coloured green apart from the top of their heads, which is blue.
In 2016 and 2017, the World Health Organization declared that the UK had eliminated measles, but this status has not been maintained as population herd immunity levels have dropped below the 95% required to interrupt measles transmission. In England, 89% of the population have received their measles, mumps and rubella vaccination, and in Leeds this currently stands at 87.1%. National, regional and local work is underway to improve this coverage, and this has been identified as a priority in the NHS England's vaccination strategy and improvement plan. The barriers to immunisation. Vaccine hesitancy is a relatively new term which is used to describe anyone who is doubtful about vaccinations or who choose to delay or refuse immunisations.
3 rows of blue-coloured baby and toddler stick figures are shown. The middle pair turn pink, quickly followed by surrounding pairs spreading outwards.
Vaccine hesitancy is a growing concern, and this has the potential to increase the reoccurrence of vaccine-preventable diseases in children. There are a number of reasons why parents or carers may have vaccine hesitancy, including fears over the safety of vaccines, fears that vaccines overload or weaken the immune system, fears that measles, mumps and rubella vaccination will cause autism, worries about vaccinating babies at such a young age, worries about the ingredients included in vaccines and whether they are harmful to children and babies, and misconceptions that vaccines are not necessary as diseases have disappeared. How can you help to break down these barriers? Communicating with parents, patients, or carers about immunisation is important to keep channels of communication open and maintain a positive relationship. Some general principles to make an every contact count when discussing immunisations include allowing suitable time for an open discussion, listening carefully to questions and concerns, being empathetic, warm and understanding, making sure it is understood that you are invested in their child's health and well-being, providing reliable sources of advice and information, checking that any information you provide has been understood, There is lots of online content around immunisation, and it is important that people are directed to trusted and reliable sources. Information on vaccine safety can be found by visiting the NHS Why Vaccination is Safe and Important webpage at www.nhs.uk/vaccinations/is-safe-and-important/. Immunisation leaflets and guidance for parents are also available at www.gov.uk/government/collections/immunisation immunisation-leaflets-and-guidance-for-parents. Healthcare professionals, including GPs, nurses, and health visitors, will be able to offer support and advice to parents who are hesitant about vaccinations. Ask them to contact their GP for more information or to arrange a vaccination appointment. Leaflets on immunisation are also available to order from the Public Health Resource Centre. Visit www.leeds.gov.uk/PHRC for more information, or contact the Public Health Resource Centre by email phrc@leeds.gov.uk.